Good morning, students. Here we come up with the ligaments of the elbow joint. The first two ligaments we already discussed, capsular ligament and synovial membrane. Now the remaining two ligaments, which are very important, the ulnar collateral ligament and the radial collateral ligament. Now in the ulnar collateral ligament, we will just draw a line diagram. In this ulnar collateral ligament, this is the humerus, and over here let us make this as medial epicondyle of the humerus, sagittal section. Over here we are going to draw this as the trochlear notch of the ulna. So this is ulna trochlear notch. Ulnar collateral ligament will be attached to the medial epicondyle. So above it is attached to medial epicondyle. The apex will be attached to the medial epicondyle. So here let us draw very simple. From here, this apex of medial epicondyle ulnar collateral ligament is attached. Apex of ulnar collateral ligament towards the medial epicondyle. Now the ulnar collateral ligament is distinguished into three bands. So it is demarcated as three bands: anterior band, posterior band, inferior band. The anterior band will be attached to the coronoid process of the ulna. Which border? Medial border of the coronoid process of the ulna. So therefore, this is how the anterior band will be attached on the medial border of coronoid process of ulna. Posterior band of ulnar collateral ligament will be attached on olecranon process of ulna, but on the medial border. On the medial border of olecranon process of the ulna. This is where posterior band will be attached. So anterior band attached on the medial border of coronoid process of the ulna. The posterior band of ulnar collateral ligament, which is attached on the medial border of the olecranon process of the ulna. Now apex of the medial collateral ligament is attached to the medial epicondyle of the humerus, and the inferior band will be the oblique band which will connect the lower ends of the anterior and posterior bands. So this is the inferior band, and this inferior band will be attached throughout the medial margin of the trochlear notch of ulna. We know that the trochlear notch of the ulna is formed anteriorly by coronoid process and posteriorly by olecranon process. So the inferior band will connect the medial margin of the coronoid process as well as olecranon process of the ulna. That means the inferior band will connect the lower ends of the anterior and posterior bands. So in this way, this is the ulnar collateral ligament. Now here you can mark this as anterior band. Over here you can mark this as posterior band. Over here you can mark this as inferior band. Then the gap which is present between these three bands of ulnar collateral ligament is filled up by intermediate fibers. The intermediate fibers will fill up the gap which is present between these three bands of ulnar collateral ligament. This ulnar collateral ligament is overlapped by what are the structures that are related to ulnar collateral ligament? What are the structures that are related superficial, or the ulnar collateral ligament is covered by the following structures. What are they? Here we go. The structures that are related superficial to ulnar collateral ligament will be covered by triceps. It will also be covered by flexor carpi ulnaris muscle. It will also be covered by flexor digitorum superficialis muscle, and it will be closely related to ulnar nerve. It is closely related to ulnar nerve. So therefore, in this diagram, you can draw the ulnar nerve in this way. These are the structures that are overlapping the ulnar collateral ligament. Now, second, radial collateral ligament. Now, in the radial collateral ligament, if we come on this side, same way, in the radial collateral ligament, suppose we draw the sagittal section. Here, we draw the sagittal section of humerus. This is the lateral epicondyle of the humerus, and we simply show at this stage we show the annular ligament which is present at the superior radioulnar joint. So supposing here at this level there is the head of the radius. If this is the head of the radius, it will be completely covered by annular ligament. This is how we show the annular ligament. The fibers of annular ligament which is covering the superior radio-ulnar joint. So this is the annular ligament. And here you can mark this as annular ligament of superior radio-ulnar joint. Now our radial collateral ligament will be attached to the lateral epicondyle. The apical part is attached to the lateral epicondyle, and from there it will pass downwards, the fibers will pass downwards and will be attached to the annular ligament. This is how the radial collateral ligament is present. The radial collateral ligament, above it is attached to the lateral epicondyle, and below it will be attached to the annular ligament. This is radial collateral ligament. So therefore, here you can mark this as radial collateral ligament. Now this radial collateral ligament is again related to certain structures, or certain structures will overlap the radial collateral ligament. What are those structures? There are two structures that are closely related to radial collateral ligament that will overlap the radial collateral ligament, and they are supinator muscle and extensor carpi radialis brevis muscle. Extensor carpi radialis brevis muscle. These two muscles, they will closely overlap the radial collateral ligament, supinator and extensor carpi radialis brevis muscle. Now, after finishing these two ligaments, ulnar collateral ligament and radial collateral ligament, other two ligaments we have finished in the previous segment, that was capsular ligament and synovial membrane. These are the four ligaments of elbow joint. Capsule, there is fibrous capsule, synovial membrane, ulnar collateral ligament, radial collateral ligament. Now, what are the relations? We come on this side. What are the relations of elbow joint? In the relations of elbow joint, anteriorly, the elbow joint, anteriorly, it will be related to brachialis muscle, biceps tendon, then brachial artery and median nerve. These are the relations of anterior part of elbow joint. Now these relations are many times asked in MCQs 1 mark question answer, but these relations you have to note down. Then posteriorly, the elbow joint will be related to two structures, very important, triceps and the enconius. Triceps and enconius, not S, but it will be enconius. These two muscles are related posterior to the elbow joint, triceps and enconius. Then medially, it is, elbow joint is related to the common origin of superficial flexor group of muscles of forearm. Superficial flexor group of muscles of forearm, medially. Also the flexor carpi ulnaris and ulnar nerve. Then laterally, just as this opposite, laterally, common origin of superficial extensor group of muscles of forearm. Superficial extensor group of muscles of forearm, laterally. Medially, common origin of the superficial flexor group of muscles of forearm. Laterally, common origin of superficial extensor group of muscles of the forearm. And also laterally, it is related to supinator, extensor carpi radialis brevis and radial nerve. Also it will be related to radial nerve laterally. These are the relations of elbow joint. Now we come to bursa. Please come on this side. Now these bursa are also asked so many times. 3 bursa. 1 bursa, the first bursa, it is located between the insertion of triceps and capsule of elbow joint. So please note down, between the triceps tendon and the capsule of elbow joint, capsule of elbow joint. Between the insertion of triceps and the capsule of elbow joint, posteriorly. And this is exactly above the olecranon process of ulna. So this will be exactly above the olecranon process of ulna. Above the olecranon process of ulna. This is the first bursa. Please note down. Now second bursa. Second bursa will be behind the olecranon process. Behind the olecranon process of ulna. Exactly at what place behind? It will be located as subcutaneous bursa. It will be located as subcutaneous bursa, which is present just below the skin and present just below the skin and present superficial to posterior triangular surface of the olecranon process of ulna. The posterior triangular surface of olecranon process of ulna. So this is where the bursa is located. These bursae do not have any name. That is why the locations are very important. The second bursa, once again I'll repeat, it is located behind the olecranon process. First one was located above the olecranon process. Second one behind the olecranon process, and it is located just between the skin and the posterior triangular surface of olecranon process of ulna. So that means it is located just behind the posterior triangular surface of olecranon process of ulna and deep to the skin. So that is why it is called subcutaneous bursa. The second bursa is called subcutaneous bursa because it is located just superficial to posterior triangular surface of olecranon process of ulna. This is the second one. Third bursa will be located anteriorly somewhat where there is insertion of tendon of biceps. The biceps tendon is inserted on the radial tuberosity, tubercle of the radial tuberosity. So therefore, just in front of the insertion of biceps, and the anterior part of radial tuberosity where it is inserted, this bursa will be located. So therefore this bursa will be located in front of the insertion of the biceps on the radial tuberosity. This is the third one. Here we finish the bursa. Now arterial supply. Now in the arterial supply, elbow joint is supplied by numerous branches from the anastomosis of elbow joint. So different branches coming from anastomosis of elbow joint will supply the arterial supply to the elbow joint. This much is sufficient. Then comes the nerve supply. Now in the nerve supply, please note down, anteriorly the capsule will be supplied by the branch of musculocutaneous nerve. So the branch of musculocutaneous nerve will supply the anterior part of the capsule of the elbow joint. Probably that branch is from the nerve to brachialis muscle. So nerve to brachialis muscle, which is a branch of musculocutaneous nerve, will supply the anterior part of the capsule of the elbow joint. Then lateral part of the capsule of elbow joint is supplied by a branch from radial nerve, and that branch is from the nerve to enconius. Medial part of the capsule will be supplied by ulnar nerve, and this ulnar nerve will also supply the ulnar collateral ligament. So three nerves you have to remember. Number one, musculocutaneous nerve, which supplies the anterior part of the capsule of the elbow joint. Then radial nerve, which supplies the lateral part of the capsule of the elbow joint. Then ulnar nerve, which supplies the medial part of the capsule of the elbow joint. So here we finish the arterial supply and nerve supply. Thank you very much.